welcome to our second segment of this interview on bariatric coaching. And today we're interviewing Dr. Ricardo Lopez from the Obesity Center in Guatemala. He's a bariatric surgeon. And now we're going to go to our other question on this topic today on bariatric coaching. So, Dr. Ricardo Lopez, as we've been talking about different, bariatric surgeries, what is your thought on, do all bariatric surgeries need coaching?
Well, as we said, coaching is a leading process that will take you to this road and give you a better outcome. And definitely, it doesn't matter what type of surgery are you being, it's going to be performed in any patient. Definitely, yes. Any type of surgery, any type of bariatric surgery will have different process of recovery, but all those processes will have a better outcome if you are guided and if somebody is helping you in a coaching process like we're the one that we are talking. To go to why are we talking about different type of procedures, it's because mainly in bariatric surgery we have two type of procedures. The type of procedures that will only be restrictive procedures and the type of procedures that will be restrictive and malabsorptive procedures. And the main difference between the two of them is that a restrictive procedure will limit the amount of food. It will make changes in the amount of food that you take, or it will make a restriction in the amount of food that you can take every time that you eat. And the difference between a procedure that's malabsorptive, that any process, any procedure, any surgical decision that we make as bariatric surgeons, all the surgeries will provoke a restriction in the amount of food that the patient will take. So there comes the first steps of coaching, because when you go to your house, when you are in your home, then the question starts. I don't have that type of liquid. I don't have that brand of Jello. I don't know what's the meaning of a puree. I don't know what's the meaning of semi-solid. And how many days do I have to take clear liquids? So what's the difference between a clear liquid and a complete liquid? And so those many questions start popping out, and you don't have your surgeon in your house, and definitely most of the time you don't have your surgeon even on call immediate. So if we have a coaching process in any type of surgeries, the main step or the first step is going to be about my recovery, immediate recovery. And most of the questions is going to be about the amount of foods, type of foods. And I believe you, as a bariatric patient, know the process of getting into your house, getting home, and not start wondering how it's going to be the recovery process and the eating and all of that. So in any type of bariatric surgery, we will need definitely coaching. It does not depend on the process. We all, in any bariatric surgery, we will need guidance. So Bari Better, it's the best option that will give you anywhere, anytime assistance on that recovery, despite of the type of surgery that the surgeon decided to do with you as patient.
Yeah, this is a great point. So we do have clients who had all the kinds of bariatric surgeries that you can talk about it. It's very interesting because I always tell my clients, remember, we do not give any medical advice at Bari Better. So I always recommend that they keep in touch with their bariatric surgeons. We do have clients that they are years after surgery, so they've been through this journey for many years now, and they still have issues with falling back on old habits and things like that we'll be talking in another segment here in our interview today. But I always tell them, very important that you keep in touch, and you do have once you are reaching that year or two, the annual checkup with your bariatric surgeon, right, where you check the patient's labs and the blood work and everything that you do on your own protocol, whatever clinic that you are. Also, always check with your nutritionist, because when we do the coaching, I always ask them, like, do you know how much protein you should eat? Do you know how much, what is your intake? And obviously, you know that from your surgeon, your nutritionist, and not right. Are you following up with your psychologist? All of that, as we always talk in the conferences that we meet with every surgeon and in our different teams, it's a multidisciplinary approach, right? So very important for those patients to have all of that information. So then when they're home, when we're doing the coaching, I would then know how much proteins that they know that they should eat. What phase are they, right? Because everyone is in a different phase. Depends on the doctor. Some bariatric surgeons will ask,
Yes.
right? Like some bariatric surgeons will ask a patient to do a 2-week pre-op on, protein shakes. Some of the doctors won't have the same. So that's why I tell people It's very important to follow through your plan. You will know what is your, goal weight from your bariatric surgeon. You know what is your, protein intake, and what is your, food planning from your registered dietitian, your nutritionist. So those are a combination of all, and therefore then the coaching can provide the other steps and things that the clients will need on a daily basis. And we talk a lot about emotional eating. Yes. What else is behind your brain that it's making you going for that food now, that before you were not feeling that you want to eat it again, but now you're going back to that old habits again. So let's explore a little bit. You talk about, different types of surgery. If you can explore a little bit more with us on the other, types that you just mentioned not a while ago, so people understand a little bit more, because I do have clients and also people in life that they ask me, like, Amanda, I hear a lot of bariatric surgery, but I also hear a lot about metabolic surgery. What is the difference? So if you please explain to our viewers and audience, that would be great.
Okay, yeah, it's a topic that we can talk during hours and hours, definitely. But the main aspect about a restrictive bariatric procedure itself, or a metabolic procedure itself, is that we create anatomical changes in the stomach, or anatomical changes in the small bowel, in order to make the food not pass through a very important segments where calories or fat or some vitamins are absorbed. So we try to make the food not to cross over those segments. So we are going to limit the body to absorb some type of carbs and some types of fats, and definitely we are going to limit the absorption of some types of vitamins. So the body will react and will understand that we are in a certain type of diet, and we need to make some metabolic changes in order to absorb the amount of food that we are taking. So we are restricting the amount of food, and the food that we're taking, it's overpassing a segment in the small bowel. So that will give us more metabolic power in order to have restriction of diabetes, of hypertension, of hypertriglyceridemia. So we call those changes metabolic surgery. And there are other type of surgeries, as having a band, having a ring, or having a sleeve gastrectomy, that will only restrict the amount of food that I take. But that food will follow the normal anatomical segments, and the food will go through the exact same segments where carbs are absorbed, where fat is absorbed, so will not make any changes in the absorption. So those will be the main difference between a bariatric surgery itself, where I only need weight loss, or a metabolic surgery when I need weight loss plus the remission of comorbidities of obesity, as diabetes, hypertension, etc. So that's the main when we talk about bariatric or metabolic. Or one thing it's important, every bariatric or weight loss surgery, it's a metabolic process, but we have metabolic surgeries that have more power changing the metabolism in order to have remission of comorbidities of obesity. That's the main thing.
This is a great clarification. Thank you for clarifying to our viewers and listeners, because people do come up with this question a lot, and it's very important for people to understand really the difference in that on the segment. So thank you. This is a wonderful segment again. And now we'll move on to our third segment. I appreciate your time in answering this great question.
Thank you.